Nice. So, welcome once again, Mr. Ekele. We're happy to have you here on our fifth episode of LabTalk Podcast, which is titled Understanding Post-Analytic Errors in the Laboratory. So, we are very happy to have you as guest speaker for our fifth episode. So, I'm going to give you the honor to introduce yourself to us and our audience, who is Mr. Ekele. And I would like to equally remind our audience that Mr. Ekele is from Nigeria. First guest from out of Cameroon. So we're happy to have you. So, sir, kindly introduce yourself to us.
All right, thank you very much, Mr. Tiku. It's actually a privilege being here on this platform. I really hold the honor. I really hold it in high esteem being invited to this platform. Well, my name is Ekele Kenneth Kihodu. I'm actually a medical laboratory scientist practicing here in Nigeria. Currently, I work with the Delta State Ministry of Health. Delta State is a state in Nigeria. I'm posted to one of the tertiary facilities in the States where I work in I head the unit actually, the clinical chemistry department. So I've been working on the bench for quite a while, and it's been an amazing experience. And medical laboratory science is a profession to love. It's really a profession to love. And I really applaud this initiative,
Wow.
interacting with
Thank you very
our
much.
colleagues and then training our upcoming scientists in the right way. So it's really something nice. Thank you.
Exactly. Thank you very much for introducing yourself to us. It's really a pleasure to have you on set and to share in the knowledge that we have. So thank you very much for being part of us today. And I'm happy that you have a lot of experience to share with us. You know, it's always good that when we have amassed a lot of experience, maybe in a particular field, and it's always good to share with peers, juniors that are coming up so that they can learn without making the errors that we did in the past. So that's why we actually bring up an initiative like this one to avoid some errors that we made in the laboratory that caused the life of some people or some patient in the laboratory and in the hospital entirely. So thank you very much for joining us. So we're going to dive directly into the topic of today, which is understanding
All right.
post-analytic tools. So I would like to hear from you, from an expert from Nigeria. So tell us what is what happens at the level of post-analysis exactly? What happens there?
I feel flattered when you call me an expert. Well, I'm just a professional, trying my best to deliver quality laboratory output, and it's actually a bane of medical laboratory practice, delivering quality results, quality outputs. Now, we know from all indications, from literature, from what we've heard over that up to about 70% of medical decisions are based on laboratory results, meaning that laboratory process, laboratory outputs is very, very vital in patient management. Now, when we talk of quality in the laboratory, talk of everything is all encompassing, all the processes involved in testing, including things you do prior to testing, which we call the pre-analytical phase, the things you do during the main testing process, which is the analytical phase, and then the things you do after the testing, which is our focus for today, the post-analytical phase. Now, from all indications, I've checked some literatures, I've actually made some research on this topic a while back, and I saw that up to about, depending on where you look, though, you can have prevalence from ranging from anywhere from 15% to as much as 30% of laboratory errors emanating during the post-analytical phase, which makes it very significant and vital. You understand? So, and if you look around, most of the facilities, most of our colleagues, most institutions, what they focus on is most of the SOPs have targeted at getting it right at the pre-analytical phase and then the analytical phase, making sure the machines are functioning optimally, making sure that you have the right sample, right containers, right volume. But then there is a little gap. Most leave out post-analytical phase to the discretion of the scientist. After you are done testing, what's next? Understand? So, and it's a very key and vital process because an error at this stage can actually undermine all the good work prior to testing and during testing.
Exactly.
So, in a nutshell, post-analytical phase of testing is just those procedures, those steps, those things you do after you are done with working on a sample, after you are done with testing. What do you now do to make sure that the result gets to the right quarters? What do you now do to make sure that the result gets to the right person at the right time and in the right format? Because that is every bit as important as getting it right during analysis. You understand?
Yeah.
So, like I've said, it's just all encompassing. And when you talk of post-analytical phase of testing, talk of things like your turnaround time, result validation, result preparation. There are some tests you do which might require calculations. You might have done your analysis and your result is out, but you might need to report in a different unit, which might require you to calculate with a formula or convert with a
Brilliant.
formula. So if you get it wrong at that point, automatically you are giving a wrong report. You understand? So these are the things that actually makes up post-analytical phase of testing.
Oh, thank you very much for that clear answer. You've really broken it down into the simple step for us to really understand what really happens at that particular stage. It's well understood and clear. I believe even nursing school people will understand what you've explained. So everything that happens after you are done preparing the sample and analyzing it. Thank you very much for that. And now that leads me to the next question
Thank
on
you very much.
what are the types of errors that happens at this phase? Is it an error in transcribing? Is it an error in delivering the results? What are the errors that happen at this particular phase precisely?
All right, thank you very much for that. The errors at this phase of testing, sorry, are numerous. It includes transcribing. It includes even typographical errors while trying to transmit your results. So you can talk of transcribing errors, you can talk of transmitting errors, you can even talk of something as small as turnaround time. A delayed turnaround time is a post-analytical error. There are times where you might, for those of us who are working in a very busy facility with a very busy emergency units, where time is of the essence, every second counts, where the people on the other end of the line are waiting to act based on your results. So every second becomes vital. If you are done with your calculation, with your analysis, and you just say, oh, let me give myself 5 minutes to stretch my legs or probably to drink water or to eat or to just relax. That 5 minutes can be vital. It can even be faster. So
Yeah,
turnaround time, result transcribing, result transmitting, interpretation of results too also forms a part of the post-analytical phase of testing. There are times you might want to make a report. Let's assume a complete blood count. Now we know the ranges for most of those parameters in our CBC differs from for an adult male and an adult female. Even the ranges for a child differs from that of an adult. So if probably in the course of trying to hurry or trying to make your report, you use the range for a child
for
for
another.
an adult, that is an error. Yeah,
Mhm.
that is an error already. So that is something, that is what we really mean when we talk of post-analytical phase. It might not be something very big, but it's an everyday occurrence. It's something we encounter every day in the lab practice. So, yeah.
Wow. Thank you very much for that. There's a point that you mentioned that is really interesting to me. We always have this notion that when you get to the hospital, you all have this handwriting, that doctor's handwriting are always very terrible. So, so I don't know if it's a myth or if it's a fact, because I myself, I do write well. I'm not trying to throw flowers at myself, but I write well. because transcribing results to a patient is very, very important. You cannot be sending out a result that the doctor cannot even read what you have written. It's very, very devastating, especially to the patient, because the time the doctor has to use to maybe attend to the patient is instead trying to read what you are saying. That can take in even as much as 10 minutes. And you mentioned that every second counts in patient treatment. So I think that's one fun fact that happens in the hospital, handwriting, which can be very terrible. So I want you to actually walk us through some of the steps that the laboratory can take in order to improve reporting in the laboratory, especially at at this phase of the analysis of patient sample. How can reporting be improved?
Okay, thank you very much, Mr. Tiku, for that question. And just to make a comment on on what you said about legibility of handwriting.
Yeah,
Well, to some it might be a myth, to some it might be a fact, but one thing remains certain. The
yeah,
whole point of communication is ensuring that there is understandability at the other end.
yeah,
When you are communicating, the aim is to ensure that the other person understands what you are saying or what you are the message you are trying to pass.
yeah. The
So
receiver must understand what you are giving out.
exactly. So legibility of the handwriting is very, very vital. And for scientists, we actually encourage that. Write legibly, write clearly, write
Yeah.
something very visible that can be read and understood. Well, just to add to from the question you asked, I would say something. As medical laboratory personnel, because of the nature of our work, like we have read about them, medical decisions and anything from laboratory outputs. So it's very vital. The nature of our work is very vital. So one of the qualities we always look out for in a medical laboratory personnel is meticulousness, carefulness, attention to detail. You know, it's it might seem like a basic something, but it cannot be overemphasized actually. It's very vital. Now, I'll give you an example from an experience I've had actually from one of my previous places of work. It was actually towards the close of shift. There was an emergency, and one of the requests that was made, the sample was forwarded to the laboratory, everything perfect. Samples collected in the right containers, right volume, and all that. Requests came in the LIS. And one of the requests that was made was a random blood sugar, a random blood sugar test. And after the analysis, the result was, I think it's, if I'm not mistaken, should be something in the hyperglycemic range.
Mhm.
Three, I think 3.2 something. Now, being that it was towards the close of shift, you know what really happens at that point? Everybody's hurrying, trying
Exactly.
to clear their
Everybody.
bench so that they can run off home. I think there was a very simple mistake that was made by the laboratory personnel preparing the results. Instead of 328 milligram per dl, he wrote 32.8 milligram per dl.
My God,
You
that's
understand?
totally
So
something
just
different.
one point. So, ordinarily, the result was in the hyperglycemic range, but because of that error, it became a hypoglycemic result. And that is a different form of emergency.
Mhm.
Imagine being a probably a non-diabetic or a hyperglycemic patient and being treated for hypoglycemia. That could result in a medical emergency.
That could even
You
lead to death.
understand? Yes. So, but luckily, because the result was actually transmitted to the other end, luckily, one of the doctors attending to the patient was quick enough to notice it and he called the laboratory. Please, I just want to confirm this result for so person.
Mhm.
Is this actually the right result?
Yeah.
And then, communication. What are you seeing on your end? I am seeing 32.8 milligram per dl. That's hypoglycemic. Is that correct? And at that point, the laboratory personnel that prepared the result was already at the door, leaving. And then, because of the alertness of the medical doctor
Yeah.
on the other end, we were able to correct it. It did not escalate beyond that point. I imagine it was a doctor or whoever on the other end who was not careful enough
We even
to do
check.
the right thing, to ask. Yeah, yeah. Imagine he was not careful enough to ask. That could
Mhm.
have resulted in a whole different kind of emergency. You understand? So it's vital that we as lab personnel be meticulous. Well, we should always, there's a process of results verification and results authorization. You understand? So we should not take that lightly. It's very, very, very vital. It might seem little, but it's very vital that we go through the results before sending it out. And of course, for situations where we see make use of handwritten results, of course, we should try as much as possible to make our handwriting legible and readable. Thank you.
Thank you very much for that critical example. The example really depicts exactly what we are trying to explain with this post-analysis. Wow, thank you very much. And the answer you gave just actually leads to the next question on the role of communication. You know, in the laboratory, I don't know if that's common there in Nigeria. Always have this clash between doctors and laboratory personnel. I don't know if it's the same in your own country, but it's always kind of like a challenge in communication. So what's really the role of communication? Like you just mentioned through your example, that the doctor was careful enough to actually identify the error and call, which was very, very important to actually remedy that situation. So how important is communication in order to limit laboratory errors at this particular phase?
All right. Uh, I think that is most likely a general phenomenon. You know, the doctor and scientist clash. It's almost at times it almost seems like it's a power tussle of knowledge and tussle of who is right and who is wrong. But at the end of the day, the important and the goal is to ensure patient safety, to ensure that the right treatment is delivered to the patient. So at whatever stage, once it comes to professionalism, once it comes to lab work and hospital work and the medical related decisions and
Yeah.
actions, we encourage that we keep aside every form of
Mhm.
interprofessional clash and stay as professional as we can. And the communication is something very vital, something very, very vital. Over here in Nigeria, over here in Delta State, we really try as much as possible to preach on interdisciplinary communication. That's communication between the doctors and the lab, between the lab and the nurses, within the facility to ensure that the patient gets the best form of treatment. You
Mhm.
know, it can really be the difference between a negative outcome and getting it right.
Mhm.
There are situations where when in doubt, like there are times when over here we make use of an LIMS, so most things are on the computer. But then there are times where we experience downtime and we have to make use of handwritten requests and then handwritten reports back to the doctor. There are times when you don't see what is written on it. So rather than stressing the patient relative, go back to the doctor to confirm what is writing, you can easily place a call.
Mhm.
It might be inconveniencing, but it's the right thing to do actually. You understand? Communicating to get clarity. And then if there are also situations where after the whole sample collection and analysis, and you might have some challenges in the lab. Probably your machine is giving issues, maybe it's not passing your calibration and all that. And because of that, there is need for an extension of the turnaround time. Now, let's assume the doctor is already expecting the results in, let's say, 30 minutes. But because of the challenges you're having on your end, that 30 minutes might extend to an hour. So the right thing to do in that situation is place a call through to the person on the other end, or just look for a way to pass the information. We're having a challenge at this point, although we are now working on it. We're having a challenge, but we are working on it. But the effect will be that there'll be a delay in you receiving the results. Now, and that is communication, simple and effective. So it makes the other person on the other end know that, wow, the writing is still being done, but I can take some other measures to ensure that it does not escalate after other. Understand? So we cannot really overflow this issue of communication. It's very, very vital. It's very vital. While doing what you are doing, while ensuring that you are doing the right thing, following your SOPs and all that, you should also communicate whatever you are seeing to the other person. Yeah, thank you.
Exactly. That's so true what you just said. Communicating while say carry on the process, even if there might be some minutes delay, it's always good to communicate. I'll use myself as a typical example because I had the opportunity to work in an accredited laboratory immediately after school. And the work that they do there is really, really meticulous, especially at the level of communication with doctors, right? Especially at the
Okay.
level of dialysis. Maybe you have a patient that has to undergo a dialysis session. You cannot be, you cannot receive the patient, you analyze the result, and you face a challenge and you don't communicate because the results that needs to get to the doctor is very, very vital for their next move. So it's always good. We had this system
Yeah.
of how do you call it? Intercom, right? That you can immediately
Yes,
call the
yes.
doctor if there's an issue, if you are going to face a delay, maybe there's power outage, which maybe sometimes you cannot control. So you always have that opportunity to communicate to the doctor that there's this particular issue that we're facing. We're going to get you the results in time or maybe after 10 minutes. So it's so true what you just mentioned. Communication is very good at every level, not just with doctors, even with nurses
Yes,
and
at every
other
level.
departments in the hospital. Yeah. So thank you very much. I'll just ask this question. What beats paper documentation or digital? What's more reliable?
No, sorry, I'm not sure. I'm not sure I heard you.
My question is, what's more reliable, paper documentation or digital
Okay.
when it comes
That
to
is that
results,
is
reporting
a
of
quite
results?
tricky question. But we know the world is going digital at this point. So we have no option but to move on to the digital age. Actually, it makes things more seamless and easier on you as a scientist, or on you as a medical laboratory person. Going digital actually saves time, saves the stress, and it reduces the workload, sort of. Understand? So I would pick digital over paper based. But then there are times, in this part of the world where we are in Africa and other low and middle income countries, we are still trying to get it right. You understand? Most times we have issues with power outage, we have system downtime, and then networks are not that reliable over here. You understand? So there are times when you just have to be conversant with database. So while I advocate for digital-based platforms and reporting, it's also important that we have a good hands-on knowledge of how to go about things in situations where a digital system is not available, where there is a downtime. How can we quickly switch over to paper-based so that there is no lapse or there is no noticeable lapse? Because the whole aim is to ensure that the patient gets the right form of treatment. So, like we said earlier, every decision, every minute counts. So
Yeah.
we should be ambidextrous enough to shift between both platforms when or if need be. Yeah.
Exactly. Exactly. Just to even highlight the digital stuff. Uh, at the facility that I worked, that's at the accredited facility, it was even, I think it was easier to even send results to doctors at a quick pace, in the sense that you can just either send a message or use this rather interconnected system, right? The how do you call it, the LIS, right? Laboratory Information System, where you can
LIS.
be in the
Yes.
laboratory and you just type as you are inputting the results in the machine, the doctor is immediately seeing what you are feeling, right? So it was easier and even for much faster than phone calls. So yeah, that was
Of
the
course.
advantage. I would say the unfair advantage that I had when I left school. Because most students, when they leave school, they always get to these small facilities. They don't even have the opportunity to learn quality, right? They learn just this basic stuff and they just grow in their career like that. But I had this advantage of learning from the standard. So that's why
Yeah.
I have some knowledge in what quality management system means and how we operate. So thank you very much for that answer. How we are coming to the end. When we are coming to the end of the session, it's time for giving out a large keynote regarding a particular topic. So I would like you to give us a key message that you will leave to a student or a professional about this particular aspect of post-analytic errors. What can you give them as an advice or recommendation in order for them to reduce this error and deliver quality results to their patients?
All right. So thank you very much. Um, what I would say is for every laboratory personnel should know that our work is vital. Our work counts, and delivering quality is of utmost importance in laboratory practice. So we should try as much as possible to ensure that we do the right thing always. Find there are situations where you might not be able to, maybe due to stress, severe staff shortages. I don't know if it's a challenge for you over there, but yeah, there are serious staff shortages and they have one person being overworked. So because of all that, there is a tendency to be tired. And once you are tired, there's an increased probability of making an error. But then we should also always know that whatever our error is the patient that will, might likely get it from. So we should try as much as possible to do the right thing. And then I would also say something. Currently, me and a few of my younger colleagues and all that, we are in the process of setting up a diagnostic facility, though. It's called Classic Medical Diagnostics. So we are trying to incorporate laboratory quality processes with a digital platform such that everything is meshed seamlessly to ensure optimum
Yeah.
delivery of quality laboratory and diagnostic outcome. So what I would say to young laboratory professionals or even those in school, we cannot diversify. We can encourage ourselves to embrace media and then digital techniques. Now, since we are the ones that uses these processes, we know where the errors most likely occur. So if imagine a laboratory scientist designing an LIS with the knowledge of the potential shortfalls, that would be far better than one being designed by an engineer who has no knowledge of what happens in the lab. You understand me? Now, I have one of a friend of mine, a very close friend of mine, who is also a medical laboratory scientist.
Yeah.
As part of my team trying to set up this, we've designed an LIS which incorporates it's perfect actually. I don't know, I'm actually short of words to describe it because there are different facets to it.
Yeah.
It has different features where it limits the workload on scientists in such a way that it makes you focus on what you need to focus on. Now, there are different kinds of LIS currently. You have the ones that with different features. Some might just have an auto-validation feature that once a result falls within a normal range, it delivers it straight up without you having to waste extra time, because this has an advantage of even the ones with critical value for you to focus on. Understand? It allows you to validate and focus on results with critical values. That's values that are out of range. So this is a feature or something that a laboratory personnel is in a position to understand better. So just to understand the system better, I believe it would be right. I believe it would be nice if we encourage ourselves to really diversify to the point of designing these things that we need, just to understand the potential shortfalls and then the advantages that comes from it. So that is what I would say to any scientist actually out there. The sky is big enough. We can diversify, but we should not lose focus of the importance and the nature of our job. Thank you.
Thank you very much. That's even a call to innovation, right? We always like
Yes,
we leave school, we go to the laboratory, we use what is there, without even thinking out of the box of maybe developing those things that we need in that laboratory, right? Like what you just explained, developing the list that you just mentioned is, to me, it's a very innovative idea, because most of the time maybe when a laboratory require or needs an information system, either they buy it, or they pay subscription and stuff like that, or they pay programmers from outside to come and install, which is kind of very, very more expensive, I would say, than to develop it ourselves here in our country. I think we have all the abilities and all how will I put it, the capacity to do that. And you're already doing that. If you're already doing that in Nigeria, I believe it's possible in every part of Africa. So this
of
is a,
course, it's possible.
a
It's
very
possible.
encouraging point that you just mentioned. And this can be implemented everywhere in Africa. If it's happening in Nigeria, it can happen in Cameroon, it can happen in Chad, it can happen in every African nation. So thank you very much for that light bulb. I'll call it like
Thank
that,
you
the
very
light bulb.
much. Thank you
So
very much, Mr.
thank you
Tiku.
very much. We have come to the end of the program. Before we even go to the end of this session, you mentioned a point on we're just level about 3 minutes. You mentioned the point of shortage in staff, right? I think I will not
Yeah,
define it as a shortage in the number of staff, because universities, I think worldwide, graduate a good number of laboratory scientists. I think the problem is at the level of competence, right? Not all laboratory graduates that leave school are competent to work in the laboratory. I believe that's true for Nigeria,
of
right?
course, that's true.
So
Yes, very true.
that's the
And
reason,
so,
that's even a call to retraining, because most universities or institutions do not even incorporate this quality management system in their syllabus. So when this graduate leaves school and they get to some facilities, they have to train them. I, for one, when I left school, I had to be trained for 1 full month without touching even a pipette in the laboratory on the quality management system. So you see how it is very thorough. And it just shows us that most of our institutions do not actually train us for the work that is on the field, and which is a call for concern. And I believe that this initiative is going to answer that and other phases of this initiative, because it's a broad vision. We're equally aiming at establishing our own diagnostic laboratory here in Cameroon, which is going to be a standard and a reference for others. So that's how I answer your question to what you asked. So, so that's
all
it.
right, thank you very much. Well, it's actually true that the university education gives you the basics, but the
Yeah,
onus is on us to train ourselves to make ourselves stand out. to
Yeah,
be
exactly.
distinct.
Exactly.
Thank
The
you.
university actually does not give us what we need in the field. It's even valid for other field of work. When you go to
Of
engineering,
course,
the same thing.
it's
You
all
go to
right.
school up to master's level, but you are not still competent to work maybe in a refinery or in a construction site. So it becomes very challenging and aching at some point. So it's a call for concern to every laboratory scientist to actually go for a retraining. You see, right? So that's how I answer it for me. And that's what inspired me to start LabTalk Podcast. So that's my own little
That's
contribution
actually a very laudable
to the current
initiative.
challenge. So, Mr. Ekele Kenneth, thank you very much for honoring this invitation for today. You have been an amazing guest. Thank you very much for your detailed answer and for the many examples that you've given in order to clarify the doubt around post-analytic errors.